Hello. Today's question is from a woman who is about 20 years of age, G-sized breasts, and is interested in getting a breast reduction. She recently obtained insurance and now is looking to do some consultations and wanted to know whether it made sense to have multiple consultations before deciding on a surgeon to do the breast reduction procedure. And the answer is, and also are additional referrals necessary to get the procedure done? So we have kind of a multi-part question here. First of all, it's a great idea to meet with more than one surgeon before undergoing any kind of surgical procedure, especially cosmetic surgery. In this case, we're talking about an insurance-covered breast reduction. And the reason being is you want to make sure that you're choosing a surgeon that's going to be a good match for you and that you're comfortable with the technique they're using and the results that they will typically be able to obtain are what you're looking for. So you may meet with somebody and say, that's the surgeon for me, and that's great. But it's nothing wrong with getting multiple consultations. Usually a couple is fine because the information tends to kind of repeat. So at that point, as long as you're comfortable with the person's skill set, if you have a good match, that's really going to be where the decision takes place. Oftentimes, friends and family are going to be the big referral, and you may be comfortable choosing someone based on the experience of a relative or close friend. So in this case, I agree with getting more than one consultation for this young lady. Now, the question is with insurance coverage and what referrals are needed. This gets a little trickier. You're talking about doing the procedure on insurance, so they will have different requirements depending on the company. And yes, there might be the need for different referrals. There might be the need for physical therapy and other types of treatments to have been tried first before they will cover the procedure. And it's important to keep in mind that not all plastic surgeons accept insurance for this procedure. That can be a good and bad thing depending on your perspective. Practices that tend to take insurance for breast reduction surgery may do them kind of all the time for that community, and they may get all the referrals. They may be very good, they may not. They may just be the group that is willing to accept whatever insurance is. So you have to dig a little bit deeper to see what the story is. Some practices just don't accept insurance for various reasons. It can be a little difficult to get some of these procedures covered, and for that reason they may not take insurance, but they may be excellent surgeons in achieving good results from breast reduction surgery. And in that case, you would either have to cover the procedure cost yourself, or sometimes you can get reimbursed depending on the insurance plan. And again, you get into complexities here that go a little beyond what I can cover in a short video answer. But the important thing is to choose the surgeon that you're comfortable with, and if insurance plan considerations are a priority, then you would naturally want to choose within that plan if that's the way you would like to go. For some people, the surgeon and the procedure are the priority and the cost may be secondary, and then in those cases, you can often get some of that deferred if the surgeon provides you the notes, you can get reimbursed from your own insurance company in some cases. So that's the basic overview of the issues covered in that question, and I hope that helps to answer things for you. We'll see you next time.